When a patient walks through the door, I always say, like, they never have to leave, and they don't either. We have patients who have been with us for, like, the past 6 years, now they see our therapist and nurse practitioner. We have patients that whose entire family now has come under our circle of care, so I'm very, very, very proud of that, and really just, like, energized about how it came so naturally as well, right? So part of that was also just listening to the needs of my community and always thinking, "What's next and how can I better support them?" So currently, Nest and Nurture Health, we have a team of 4 dietitians, we have 1 MSW therapist, and 1 nurse practitioner. And our services include 3 to 6 month nutrition programs with the potential for ongoing care. We provide diagnostics, lab work, medication management, and one-on-one therapy care for women navigating hormonal and metabolic conditions. I've been with Practice Better from the very, very start. It was the only EMR that I came across that felt very tailored to nutrition professionals. Now I don't have to have people use Chronometer and export that to me. I don't need to have people use like these third-party apps, right? They had like journals. We don't have to have people do like pen and paper and then fax it to me, which is like wild, right? I would never ask a patient to do that now. Everything is done through a practice better from the booking appointments, the documents, the consent forms, the protocols. That from a client perspective, it's just a one-time create a new account and that's it, right? So from the client perspective, it's centralized. I would hate for a client to have to create 5 different logins and coordinate like 5 different calendars, right? Or work in a space where because the care isn't integrated and because there isn't communication between the different types of professionals, they have to like repeat their story a million times. They're setting goals with different providers that don't align, so they're just like confused, right? So by having everything in-house, it's just truly they just do something once, they show up, it's the same link each time, and it's whatever care that they need in that moment. So I think it honestly makes it so much easier for them. I think of it, it's a virtual care clinic, right? So everything's there. Because we do provide interdisciplinary care, we use a lot of the, like, internal chat box function a lot more than when I was just, like, a solo provider. I still use it for, like, patient care, talking to patients. It's a great way for patients to, like, stay connected to their providers. If we have a patient who just got referred to our nurse practitioner for an assessment and to run diagnostic labs, then we have an SOP where the nurse practitioner would then, like, download everything onto the patient portal. They have access to each other's notes, the dietitian and the nurse practitioner, and they'll go into the chat box and just send a private message just to the dietitian and be like, "Hey, brief overview of the assessment, just so you know, documents updated now," right? And that just makes everything so seamless and there's no like crazy back and forth like email chains and like some might not be secure, so it's all like PIPEDA approved. When a patient comes in, what they do is they'll sign on, they'll get a program, right? We automatically collect their credit card information right off the bat, so we're not chasing people for invoices. And then if they have initial assessment booked with us, then they automatically get an intake form and the consent form, right? So we can get all the legalities and the housekeeping out of the way. And they also get automatic email reminders and text reminders before the session too. So from the intake form, the clinician's able to just get a little bit of like existing background so they could really focus that session on that quality of care. After the session, they get automatic access to the journaling to start tracking. They get automated client satisfaction surveys, which is something that I implemented as we started growing the clinic just for quality assurance, just to also like early flag any patients who may not be satisfied in their care, because we can then open up the conversation on how we can better meet their needs.